everyone. In this module, we'll discuss the approach to a patient presenting with vertigo. So vertigo, as you all know, is a common medical complaint with which the patient can present either to the physician, the neurologist, or to an ENT specialist. Now, the fact that this is such a common medical complaint makes this module all the more important. It is very important for a clinician to have a proper approach to a patient presenting with vertigo so that you can make an accurate diagnosis and start the treatment. So let's start the discussion on approach to vertigo. First of all, let's try to understand what is vertigo. So how can you define vertigo? Vertigo is a hallucination of movement secondary to a vestibular disturbance. So there is no actual movement, but there is a hallucination of movement. And since this occurs secondary to a vestibular disturbance, this is a perfect example of a vestibular system disorder. So vertigo occurs due to a vestibular system disorder. You can also say that vertigo is an erroneous perception of self and or object motion. So remember, I was just talking about a hallucination of movement. So this hallucination can be internal or external. You can have a feeling that you are rotating. You can also have a feeling that the surroundings are rotating. That is, the visual surroundings are rotating. And some people loosely give a term internal vertigo and external vertigo, but it is not so commonly used. Okay. So self motion and or object motion can happen in vertigo. And remember, this is typically but not always a rotatory motion. So commonly you will have a rotatory motion in vertigo. That is what the patient often complains of, this rotatory motion. Clear? Okay. Moving forwards, very important, what is the pathophysiology of the vertigo? So remember, vertigo occurs, very important, due to an asymmetric labyrinthine discharge. Asymmetric labyrinthine discharge. And remember, the lesion can lesion can be anywhere in the pathway. So the lesion can be either in the labyrinth, the vestibular nerve, the vestibular nucleus, and also the connections of the vestibular nerve. But please keep in mind, when you have got a bilateral symmetric lesion involving the vestibular system, you usually do not get a vertigo or nystagmus. And what is the reason for this? Remember, I just told you a while back, it occurs due to asymmetric labyrinthine discharge. So in bilateral symmetric vestibular dysfunction, there is no asymmetry, so you may not have vertigo or nystagmus. But even in a bilateral lesion, you may still have some sort of imbalance. So the patient can experience imbalance. Okay, I hope that is clear. Moving forwards, see, when a patient presents to you with an apparent vertigo, how do you approach this? So as a clinician, the first question you've got to ask yourself is it a true vertigo or not? And if you are convinced that this is a true vertigo, is this a peripheral vertigo or is this a central vertigo? Okay, two simple steps. Let's move forward. The first step, is it a true vertigo or not? So what is this true vertigo? Now, if you've got to understand what is this true vertigo, it is very important to understand what is dizziness. And is dizziness the same as vertigo? Let's try to understand. So I'm just bringing this term dizziness. So what is dizziness? Now dizziness, remember, is a general term for a variety of